road traffic accident. So patient will present with a history of fall from the bike or accident. There will be body bruises and bleeding, right? On examination, I will check vitals of the patient, that is blood pressure, respiratory rate, pulse rate, temperature. Then I will clean and wash the wound with spirit and pyodine to avoid contamination. Then I will assess GCS of the patient to determine the patient's level of consciousness, right? Then I will do other investigation, that is if chest is involved, then I will do chest x-rays. If abdomen is involved, then I will perform abdominal ultrasound. And if bones are involved, then I will perform an x-ray, right? Now let's come to the management of RTA. And if bowel injury is suspected, then advanced imaging such as CT scan or contrast imaging may be required, right? Now let's come to the management. So if a patient is stable vitally, or we can say that if the patient is hemodynamically stable, then the management includes injection TT, IM state, right? It's prophylactically. Injection toradol or urine is basically ketorolac, IM state. Then dressing the wounds using sterile technique is necessary. We can also go for topical antibiotics such as Bactroban, right? Which is basically mupirocin, or we can also give fusidic acid 2% cream twice daily for about 5 days, right? And we can advise the patient to return for follow-up after 2 days or earlier if there is increasing pain, swelling, fever, or persistent bleeding, right? So the management of a road traffic accident patient begins with assessment of vital signs, wound care, GCS evaluation, then comes appropriate investigation, then pain control, tetanus prophylaxis, proper dressing, and regular follow-up is necessary, right? So this is all about road traffic accident. Also, let's say if the patient is not stable, then our priority is not wound dressing or routine investigation. We'll first follow the trauma ABCDE approach, right? That is first of all airway plus cervical spine protection. Then comes it is A. Then comes breathing, right? Then C for circulation and hemorrhage control, right? And then we'll go for disability. It is SSGCS and pupils, and check the blood glucose, right? And E for exposure.